Medical ethics is like a compass that guides healthcare professionals. It helps them navigate difficult situations and make decisions that are morally sound. This field is crucial because it ensures patients receive the best possible care while respecting their rights and values. Medical ethics isn't just about following rules, it's about understanding the core principles that should always guide medical practice. Imagine a doctor facing a complex case where different treatment options have varying risks and benefits. Medical ethics provides a framework for the doctor to weigh these options carefully. They can then make a decision that prioritizes the patient's well-being while considering their autonomy and values. This thoughtful approach is essential for building trust between doctors and patients. The roots of medical ethics can be traced back to ancient Greece, particularly to the influential figure of Hippocrates. He is considered the father of medicine and is renowned for the Hippocratic Oath. This oath, taken by physicians for centuries, emphasizes key ethical principles like beneficence, non-maleficence, and confidentiality. Hippocrates believed that doctors have a moral duty to act in their patients' best interests and to avoid causing harm. The Hippocratic Oath formalized these ideals, shaping the ethical landscape of medicine for generations to come. Even today, the oath serves as a reminder of the fundamental responsibilities healthcare professionals bear. While the Hippocratic Oath laid the groundwork for medical ethics, the 20th century witnessed horrific violations of these principles, particularly during World War II. The atrocities committed by Nazi doctors in concentration camps shocked the world and led to the development of the Nuremberg Code. This code, established in 1947, outlined 10 ethical principles for human experimentation. The Nuremberg Code emphasized the importance of voluntary consent, the avoidance of unnecessary suffering, and the right of participants to withdraw from research. It served as a turning point in medical ethics, shifting the focus to protecting the rights and well-being of individuals involved in research. The Code's principles continue to underpin ethical guidelines for medical research worldwide. Modern medical ethics is often guided by 4 core principles: beneficence, autonomy, non-maleficence, and justice. These principles provide a framework for making ethical decisions in healthcare. Each principle represents a fundamental value that should guide medical practice and ensure patients receive ethical and compassionate care. These principles are not always easy to apply in practice, as complex situations may arise where these principles seem to conflict. However, understanding these core principles is crucial for healthcare professionals to navigate ethical dilemmas effectively. Section 5. Beneficence. Acting in the patient's best interest. Beneficence, a cornerstone of medical ethics, emphasizes the moral obligation of healthcare professionals to act in the best interests of their patients. This principle goes beyond simply providing medical treatment. It involves a holistic approach to patient care. A doctor practicing beneficence wouldn't just prescribe medication. They would take the time to understand the patient's concerns, explain the potential benefits and risks of different treatment options, and involve the patient in decision-making. Section 6. Autonomy, respecting patient choices. Autonomy in medical ethics recognizes the right of patients to make decisions about their own healthcare. This principle emphasizes that patients have the right to refuse treatment, even if it's in their best interest. Respecting patient autonomy means ensuring that patients are fully informed about their condition, treatment options, and the potential risks and benefits of each option. For instance, a patient with a terminal illness may choose to forego life-sustaining treatment and opt for palliative care instead. Even if the medical team believes that further treatment could prolong the patient's life, the patient's decision must be respected. Section 7. Non-maleficence, avoiding harm. Non-maleficence is a fundamental ethical principle that emphasizes the importance of avoiding harm to patients. This principle is encapsulated in the well-known phrase primum non nocere, which means first do no harm. While medical interventions inherently carry some risks, healthcare professionals are obligated to minimize these risks as much as possible. For example, a surgeon must carefully weigh the potential benefits of a surgical procedure against the potential risks and complications. Thorough preoperative assessments, meticulous surgical techniques, and appropriate post-operative care are all crucial aspects of upholding non-maleficence. Section 8. Justice, fairness in healthcare. Justice in medical ethics refers to the fair and equitable distribution of healthcare resources. This principle emphasizes that all individuals should have equal access to healthcare, regardless of their socioeconomic status, race, ethnicity, or other factors. However, achieving true healthcare justice is a complex challenge. Factors such as limited resources, geographic location, and insurance coverage can create barriers to equitable healthcare access. Section 9. Conclusion. Guiding ethical healthcare. Medical ethics plays a vital role in guiding healthcare professionals to provide compassionate and morally sound care. The principles of beneficence, autonomy, non-maleficence, and justice serve as a compass, helping navigate complex situations and ethical dilemmas. By upholding these principles, healthcare professionals can ensure that their actions prioritize the well-being, rights, and values of their patients. As medical technology continues to advance and new ethical challenges emerge, it's crucial for healthcare professionals to engage in ongoing reflection and dialogue about medical ethics. By staying informed about current ethical guidelines and engaging in ethical decision-making, healthcare professionals can contribute to a healthcare system that is both effective and ethical.